Hello, everyone. This is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about um, the length of treatment that a patient needs in order to get well. I think the best way to frame having tick-borne illness is to frame it in the sense that it is a chronic illness. And most likely, we will be able to put the organisms into remission. But to expect 100% cure, I have seen it, but not often. So it's perhaps better to set yourself up for a state of remission rather than a thinking that you're going to be fully cured. Because what happens is when you have a big life stress, like a divorce, a car accident, a death in the family, loss of a job, really big life events. Oftentimes, what will happen is you will relapse a little bit, and you just call my office or call your LLMD, and they'll put you back on herbs or antibiotics depending on what you want, and then you usually typically stay on them from 3 to 6 months. Then we take you off. We look to see how things are going. If you're still relapsing, then you have to go back on. Usually 6 months is long enough to get it to push it back again. With regards to how long you need to treat it, so there's huge controversy over this. Some people say, if you get an initial tick bite, you only need a day or 10 days of doxy. Well, that just is not true, because now all the ticks have multiple infections like Anaplasma, Ehrlichia, Babesia, Rickettsia, Q fever, Tularemia. I mean, on and on. And then the viruses, Powassan virus, Bourbon virus, Heartland virus. So doxy alone is probably not going to cut it. However, it's a good start. If you have a new tick bite, what I would suggest is that you call an LLMD's office, tell them it's a new tick bite, and see if you can't get an appointment quickly. So you should be on antibiotics as soon as possible so that it doesn't become systemic. With regards to how long do people stay on treatment, basically it depends on a whole host of factors. How much stress does that person have? What does their diet look like? What do they drink? Do they smoke? Do they have a lot of stress in their life? Are they compliant? How many infections do they have? What's their immune system look like? I mean, there's 1,000 variables involved in healing, and so we really have to, more than ever, we have to do personalized medicine with patients that suffer from tick-borne illness and mycotoxin illness as well. Obviously, the longer you've been infected, the longer it's going to take for me to treat you. But, we can cycle on and off antibiotics. Some people choose to do herbs, and, and that's fine. I generally stay within the belief system of my patients, because if you don't believe something's going to work, then it's not going to work. Okay. So that's been my experience in 27 years of practice, that you have to listen to your patients. Gee, what a surprise, right? The length of treatment varies for everybody. It's based on a multitude of different factors. And, you can discuss that with your LLMD. You can cycle on and off, antibiotics and herbs. And that way it'll, really support won't be so hard on your liver. So I hope you found this information helpful. I know it's a really difficult issue to grapple with, to not know how long you're going to be in treatment. But I can't honestly tell you, because this is personalized medicine. So it's especially designed for you. Okay? Alrighty. Listen, you take care. Have a wonderful day. Bye-bye.